Hi, I'm Tanya Marvin, Coordinator for Nursing Services. We've been in school for a while now, and you remember when we started school, we started with our symptom tracker for the students. We appreciate all the parents filling that out, all the students filling that out. We are still going to use that symptom tracker. I just want to let you know we're going to do a few little changes to that tracker though. In the questions that we have, those questions are divided into major symptoms and minor symptoms. The major symptoms are cough, the fever of 100.4, shortness of breath, loss of taste or smell. Those symptoms reported and a fever will send you kind of down a COVID track, meaning we really encourage you to get your child tested. You can do that either through your primary care physician. You can do that through the Mesa County Health Department at their testing site out at the Mesa County Fairgrounds. That testing site is open Tuesday through Saturday, 8 to 3. So you're welcome to go out there anytime to be tested. If you choose not to be tested and you have reported those major symptoms, then we are going to keep your child out 10 days. That is the time that we anticipate somebody is infectious due to COVID. If you are tested and you have a negative test result, then as soon as those symptoms resolve that you're experiencing, we want you to send your child back to school. If your child has some residual symptoms, it's not COVID, you still have that negative test result, but they still haven't resolved, you can go back to your primary care physician and get an alternate diagnosis that gives us what those symptoms would be related to. In that case, again, with that alternate diagnosis, we want your child back at school. We're preparing for the cold and flu season because we know that that's coming up, and that has always been something that we manage in a typical way. And so we're really trying to differentiate between colds and flu and COVID. And that's hard because they have pretty much the same symptoms. So if you report minor symptoms such as the runny nose, the nasal congestion, the headache, the fatigue, it will still take 2 of those symptoms to get you the prompt that you shouldn't come to school today. But then we're going to manage those symptoms just like we would any other year with our infectious disease guidelines that are on the Colorado Department of Public Health and Environment website. That is a public document. Anybody can get there and see what that is, but that's how we'll be managing that. So our goal is to adequately monitor and manage COVID, and adequately monitor and manage the regular colds, the flu, all of that. And the key for us is not just the symptom tracker, but then you will be receiving a call from the health, one of our health assistants or RN when your child is not at school due to illness. And we'll make a plan. How's your child doing? Do you need to go see the family physician? What do you intend to do? Do you want to go get tested? Do you want to wait and see for a couple days? That call to you will be a critical piece of determining when your child comes back to school. We anticipate rolling this out this week. We'll get the symptom tracker clarified for you with the questions because we're looking for new cough, new shortness of breath, those symptoms. And then we will roll this out this week, and then we hit the ground running, managing cold and flu season along with COVID. If you have any questions, please give me a call. My number is 254-5417. Thanks.